So we just wanted to do some introductions and say who we are. So I don't know if Amy, if you want to go first.
Yeah, of course. Hi, everyone. My name's Amy. I am an assistant psychologist. I work in-house here at UCH, working under the supervision of Dr. Kat Bonnie-Murrell, who unfortunately is ill, so she can't be here today.
Fab, and my name is Chinny Azefala and I'm a clinical psychologist and I work in long COVID services in North Central London, and I'm the long-term conditions lead in Camden, which is one of the boroughs in North Central London. And Nicola is due to be with us, but I think she's had issues on the call, so if she joins she'll introduce herself, but otherwise we'll carry on without her just to make sure we don't lose time. So we wanted to start off just with a little disclaimer about what we're talking about today. So this session is very much about psychological health, but we recognise that long COVID is a physical health condition, and so throughout today's webinar we're going to be holding the physical symptoms at the heart of all of the advice that we're giving. We appreciate that the mechanisms for understanding long COVID aren't fully understood, but we do know that the impact on daily life can be very immense, and that the challenges can have several levels on both a practical and an emotional level. So the webinar is designed with this in mind, and as with all health issues, there is a ripple effect that can occur when somebody has physical health problems, be that psychological or social. And so we're just going to be highlighting how we can pay attention to psychological health as a way of thinking about how that might impact on physical health symptoms, whether that's improving them or in terms of sometimes noticing patterns that might sometimes exacerbate those symptoms. And as James said, that the webinar is part of a series, so this we're going to be providing lots of information, ideas and strategies for managing long COVID, and the evidence, there is an evidence base to what we're providing information about, in that lots of the techniques have been trialled and are effective for NHS patients who are impacted by long-term conditions, and then we are applying these techniques to long COVID populations, and we've seen very positive effects of this as well. And of course, any advice that we do give, it doesn't replace the advice that you are given by your healthcare professionals, but if you have any concerns about the advice that we are giving, then please do talk to members of your team as well.
So, as Chinny said, today is just giving a bit of an overview around psychological health and well-being and what this means when you have long COVID and then living with that long-term health condition. We're going to talk a little bit around the common challenges that we hear as psychologists from people living with long COVID and how these can get in the way of managing our physical symptoms. We're going to talk a little bit around how to measure and monitor your own psychological health and hopefully enable you to take away a few kind of management tips and tricks that can help to manage some of those psychological impacts. And then, yes, at the end, a chance to ask some questions and reflect on what you have heard from us today. So this slide is just to give a bit of an overview of the things that we see and talk about with clients living with long COVID in psychology services. So we've obviously got some of those common physical symptoms there in the centre, and then the outside circle is to demonstrate the psychological impact that these can have. You can see at the top there we've used the term ripple effects because we really do see these physical symptoms having an impact on so many different areas of our well-being and our lives. And the two are interconnected. I'll let you have a look at these. I'm not going to read them all out, but you can see that, you know, we've got things like communication difficulties, things like a loss of identity. That's a theme that comes up quite a lot. And for example, kind of feeling anxious or fearful, and people having difficulties with those fears in relation to their physical symptoms as well. And these all of these things are kind of related to each other rather than them kind of causing each other. There's more of a relationship rather than a cause and effect.
Thank you, Amy. So we'd like you to just take a moment just thinking about some of what Amy has said just there about the impact of symptoms, and just take a moment to think about these questions that we've listed here. So how are you affected by your long COVID symptoms? How has your life or how have you been changed because of long COVID? And what have you learned about yourself with these symptoms? And what techniques or tools have you discovered along this journey with your symptoms? What knowledge have you gained? What have you found useful? And it might be helpful to reflect on this in your head, or you might want to make notes about this in terms of some of these questions, which we'll come back to later. It can be really important to reflect in this way and just notice the ripple effect of symptoms in your life, and how they might affect your overall psychological health and well-being, including noticing peaks and troughs that might come along with long COVID symptoms, because as we know that the symptoms can be relapsing and remitting, or some days could be good days and some days better days, and some days could be worse days, and just thinking about how that might impact on your mood, your thinking on those days, and also maybe your behaviour on those days as well. So we're talking today about building a sense of, or one of the main techniques is thinking about how you might be reflective and build reflective motivation through noticing vicious cycles. So this is a typical cycle that we would work through with people if they were coming through to our psychology services, and we want to introduce this as a technique for you also. So it's all about noticing what's helpful to you or what is unhelpful to you, and seeing if you can start to spot any cycles that you might want to reduce, or other cycles you might want to instill and increase in your life where there's an impact of physical symptoms on thoughts, behavior and emotions or feelings. So the idea is to just first notice your own patterns and think about whether or not there are things that you notice about how long COVID symptoms might influence some of these other areas in this cycle here. Noticing how some cycles can develop, and sometimes they can inadvertently, so not intentionally, we can develop these cycles that could be recovery slowing at times with long COVID, depending on how you might react to symptoms emotionally, on an emotional level. And also thinking about what we call vicious cycles that can develop, and they can sometimes occur because of the symptoms just being very demotivating or limiting in terms of life, and that can affect the thoughts that might pop up. Or there might be other cycles that you notice that you have that actually are recovery growing, and they are cycles that we call virtuous cycles, and they can be more positive in that there might be a mind frame or a way of thinking about things and responding that actually could be really helpful for your symptoms moving forward. So we want to just introduce these ideas to you and ask you to reflect on this really, and we've got some examples to talk through with you as well.
So one of the common cycles that we work with is a cycle of anxiety and breathlessness. So often these cycles will have a specific trigger. So in this first example here, we've got the trigger of being invited or attending a social event whilst you're feeling unwell. And so in terms of that top physical symptoms box, we've obviously got feeling breathless or having a tight chest. And thoughts that could be going through your mind at this point is things like, I'm too breathless to talk. And if I go to this party, everyone's going to think that I'm boring or unsociable. In terms of how that might impact your behaviours, so you might not go to the event altogether. You might avoid telling friends why or talking to them around what's happened or how you're feeling. And in terms of those feelings, you're likely to feel anxious or upset. So this is one of those cycles that is not a helpful cycle, and it can really impact on the quality of our life over time through a sense of disconnection caused by the symptoms and social withdrawal that we see.
Another example is maybe just a trigger of just feeling very unwell, when you might have to fulfill a responsibility or do something that's important. And if that happens, obviously there might be the very intense physical symptoms linked to long COVID, for example, fatigue, headaches, pain. And there might be thoughts that come alongside that, such as I'm useless, I can't do anything I want to do, this will never end, or I'm never going to feel well again. It makes sense to have those sorts of thoughts because of the intensity of the symptoms and the lack of certainty about how to manage going forward for many people. Some of the behaviours that you might notice might be avoiding people and not seeing people as much as you might usually because of the symptoms, but also potentially because of feeling just very demotivated, spending increasingly more time alone. And we sometimes describe a type of thinking style as ruminating, which is sort of going over and over certain things in one's mind. And one way of thinking about that could be ruminating about all the things one hasn't been able to do over the course of a week or a few weeks or over several months, and just really noticing that, and that then leading to a sense of feeling very demotivated and leading to feeling low in mood or frustrated or anxious about the future. Again, this would be a vicious cycle that could be quite recovery slowing, in that it might make someone feel very demotivated.
So when we're looking at these cycles, it can be useful to look at where we can kind of look at breaking them, or forming pathways out of them, or to make them less recovery slowing. And so one of the things that we look at is we take that box that was labelled thoughts, and we look at some of the things that are going on within that box. So we do see some common thinking cycles. So things that are up here, things like worrying or thinking about the future. Some common ones that we've categorised in psychology. So things like, you can see there, the mental filter. So almost like having grey tinted glasses, seeing only the negative aspects of a situation and filtering out all of the positive elements. Catastrophizing is a thinking style that a lot of people have heard of before, and that is the thinking pattern of imagining and believing that the worst possible thing that could possibly happen is going to happen. And then you can also see there black and white thinking, so losing that nuance, so believing that something can be only good or only bad, right or wrong, rather than anything in between. And then finally, their mind reading. So assuming that we know what others are thinking, usually about us, and thinking that they're assuming the worst in us, or thinking that we can tell what other people in a room, for example, are thinking about us. And then the critical self, so putting ourselves down, blaming ourselves for situations, often situations that are beyond our control anyway. And often we see within all of these kind of thinking styles, words can crop up, things like I should do something, or I ought to do something, or I must do something. And that kind of thinking style across all of these categories can result in often overdoing activities, things like compensating and pushing ourselves on those better days that we have. And then, as I think has been discussed in previous webinars, that overdoing can then lead to crashing due to an increase in symptoms, and leading there to a boom and bust behaviour cycle, which can be addressed and turned into a virtuous cycle using pacing, as I'm sure has been discussed in a previous webinar.
And one thing that is important to highlight is that these can be quite normal, understandable reactions to difficult circumstances, or that we all have sort of self-critical thoughts or different types of thinking styles. We have these thinking styles all the time in different aspects of life. And I think it's about noticing how these might become part of a vicious cycle or strengthen a vicious cycle, and then think about the ripple effect it might have on how one might manage symptoms, and the behaviour responses that you might have, or the feelings or emotions that might come with those symptoms, which we can't control sometimes, and those emotions can then have a physiological effect on us as well. So it's about really just noticing this. One thing we also wanted to highlight is how that there can be different types of self-critical thoughts that pop up, and common ones that we've noticed people with long COVID are struggling with are things like having a dictator or a bully, so lots of these shoulds. I ought to be doing more of this, I must be doing that, a bit like Amy just described. Or radio doom and gloom, so thinking about, well, what's the point in trying something, it won't work out, or I won't enjoy it anyway, or things will never get better. The disaster movie. So this is the sort of worrying about the future and the worst case scenarios and thinking about that, or making comparisons. So thinking about what you were able to do before, and or what other people can do that you might not be able to do. and also just general being critical internally, so the judge or the inner critics are not feeling good enough, having labels like I'm useless or feeling rubbish, or just negative words to describe yourself. And finally, the worry wart, which is just thinking about all of the things, worrying a lot about lots of different things that you might have to do, but that you can't quite do in the same way anymore. So responsibilities, finances, all of these things that may have been affected by COVID, and how to make a change to that or manage that. There might be worries around some of this, all of this is very understandable. And I suppose this is about noticing what your pattern might be in your thinking styles and how that might influence your behaviours or your emotions. And then some ideas we will introduce about how to move forward with that and overcome some of these patterns. So just coming back to these questions, based on what we've said so far, we would like you to we want to highlight that some of these cycles are a normal part of the process and the journey with long COVID, that we would expect that people would have thoughts like the ones we've described. And at the same time, like we were saying before, sometimes things can be these cycles, if they're vicious cycles, and there are several vicious cycles, and they become rigid or they become inflexible or they persist over long periods of time, then the cycles can impact on physical symptoms as well. So we wanted to ask you if you've noticed anything that you might think could be helpful to change in any of your reactions to your long COVID, or any vicious cycles that you might notice from what we've described so far. And we're going to introduce some ideas about how you might be able to respond in a slightly different way, or just notice those patterns as part of the talk today. And it's just about recognising that long COVID might affect the way that you see yourself or other people around you or the world or your future, and how that might lead to potentially vicious cycles or anxieties or additional stressors because of the psychological burden that comes with these physical symptoms. So the second technique that we want to introduce is just thinking about how to monitor symptoms. So we've introduced some ideas about noticing vicious cycles, and the next step is that in our psychology services, often what we will do, and you will be familiar with this if you've come through the UCLH clinic, is that we will ask questions about feeling bothered by any of these problems that are listed here. So little interest or pleasure in doing things, feeling down, depressed or hopeless. And these types of questionnaires can be very useful for just noticing if any psychological symptoms might be persisting over a period of time. So it can be helpful to ask these questions and judge for yourself if you feel a particular way over a period of 2 weeks, and then maybe looking at this again in a few weeks' time to see if this has changed or not. And it's just one way of capturing and noticing the monitoring psychological health over time. So often you can score these questions from 0 to 3 on each one. So if you were scoring at the higher end, so a 3 on both of these questions, then that would suggest that this is a problem with low mood, and that you might want to monitor that over time with your healthcare physician, and then think about noticing whether or not this is persisting over a period of time for a few weeks or a few months, and if you would like to seek further help with these problems. Again, there are 2 other questions that we ask people that are related to anxiety, and those are feeling nervous, anxious or on edge, or not being able to stop or control worrying. So just noticing if these are processes that are going on for you, and being able to score yourself on these questions, and then looking at these in a few different time points to see if there's been any change and if these problems are persisting for you. So monitoring psychological health is quite important. And equally, asking for help is very important as well. So knowing when to ask for help, and trying to judge for yourself about how you do that, but then also taking that step when needed. So what we wanted to say to everybody is that physical symptoms can be frightening, upsetting, disabling, and just unpleasant overall. And so what we would often say is that we expect that there will be certain reactions to those unpleasant experiences, and feeling low or feeling anxious is quite normal in response to just something awful happening in your life, like with long COVID symptoms. And I think that the important thing is knowing that if this experience of feeling low or feeling anxious and not being able to shake off that feeling at points during the day, and it persists and it's unrelenting, then that's when it might be important to ask for help. And those screening tools that we introduced are one way of checking about how these problems might persist and looking at the frequency of how you might be feeling a certain way over a period of, say, 4 to 6 weeks. And so then what we would say is that if these problems are persisting, then please do consider asking for help from your GP or physical health professionals involved in your care. And you can, if you want to, self-refer to the services that we work for across North Central London. And there's a link to doing that if you wanted to find out more. And in the slide set, there's information about how to contact our services directly as well. And then the next technique we wanted to talk about was something quite practical, which is just about paying attention to the present moment. So as I mentioned earlier on, the links between thoughts that can come with distressing and difficult physical symptoms and the emotions that you can have can also trigger off a response, a physiological response. And often we talk about stress in the body or tapping into different parts of our nervous system, and there's one part of the nervous system that's called the parasympathetic nervous system, and it's all about resting and digesting and trying to think about creating a sense of not necessarily being aroused in an anxious way, but sort of the opposite of that. When you tap into that system, it can allow you to feel calm, content, safe, connected, and it's about sort of learning to regulate or dampen down the stress response of the body. And sometimes there are certain thoughts that can trigger off the stress response, and other parts of the body that other responses that can sort of dampen down that response. So paying attention to the present is one way of sort of tapping into this part of your nervous system that can dampen down stressful experiences and stressful responses and dampen down the emotional response to that. And that can be quite a helpful effect in terms of thinking about managing symptoms as well. Inadvertently, it can be quite a helpful response. So one way of trying to manage this symptoms can also be, and the thoughts and feelings that might come with quite difficult, distressing symptoms. If you notice a vicious cycle, then it can be important to pay attention to the present in order to dampen down a stress response. So we wanted to give you an example of this and to demonstrate this in the session today.
Okay, so to start off with, just make sure that you are sitting or lying down comfortably. Close your eyes or look down at the floor if you would prefer. And so what we're going to do is just gently focus on our breathing. So as you breathe, try to allow the air to come down into your diaphragm. That's just at the bottom of your rib cage. And feel your diaphragm, that area underneath your ribs, move as you breathe in and out. And just notice your breathing for a moment. Take a moment to bring your breathing to a comfortable and regular pattern. Something that seems soothing, comforting, and your own rhythm. You might find that your breathing is slightly slower and deeper than normal. The in-breath is about 3 seconds. Hold. And then take 3 seconds for the out-breath. Try and make sure these breaths in and out are smooth and even. And now we can spend just a little while focusing on our breathing, noticing that breath coming down into the diaphragm lifting and the air moving out through your nose. Sometimes it's useful just to focus on the point just inside the nose where the air enters. So in through your nose and out from your mouth. And just focusing on that for a while. Now we can just ground ourselves by turning attention to our body, sensing the weight of your body resting on the surface where you're sitting, and allowing yourself to feel held and supported. Coming to rest in the present moment. And you might find that your mind is wandering, and that's okay. Just simply notice it happening and have a bit of curiosity about where your mind has gone, and then gently guide your attention back to an awareness of your body as best you can. And again, just sensing the flow of air coming in and out of your nostrils. And this is more about observing. There's no need to change anything, just allow things as they are. If you're finding focusing on your breathing a bit difficult, and a lot of us do, then allow your attention to rest on an object. So find something you might want to hold, or something that gives you a feeling of gentleness and calmness. And then you can just hold that and notice your focus on your object as you're practicing your breathing. And when you feel ready, slowly open your eyes and bring yourself back to the present moment. Sometimes it helps if you just have a gentle stretch and a deep breath to prepare you to carry on with the rest of this session. And take a moment to notice how you feel in your mind and your body after this exercise. Is it any different to how you felt just before doing this? These types of exercises can be soothing and relaxing at times, and the aim is just to notice your experiences rather than judging them, which can be soothing at the time, but it can also be difficult when you first start to do this. It could take a little bit of practice, just try and be aware of that. Sometimes we suggest doing something like this at least once a day if you want to progress with this type of present moment focusing. And it can be a really good way, as Chinny said, in terms of soothing your autonomic nervous system.
Thank you, Amy. And we have included in your slide sets some more information about exercises like this if you wanted to continue to do them and work on that yourself as a way of tapping into your autonomic nervous system. So the last thing that we wanted to, well, this is the penultimate thing we wanted to introduce, but it's just the idea of moving in ways that work for you, but with kindness for your body. So the importance of listening to your body and thinking about consistent and paced activity over time. So you will either have had or will have a session on pacing and fatigue management, but what we wanted to just highlight is the importance of balance and listening to your body with kindness. So we've got a metaphor that's quite a useful thing to hold in mind as a particular technique to think about balance, which is just that we often talk to people about a three-legged stool metaphor. So if you imagine that you have a three-legged stool and that each type of activity is a leg on the stool, with each leg representing necessary, pleasurable and routine activities. Think about, well, what happens if one leg is too short or longer than the others? So if you're doing mostly routine tasks or not many pleasurable tasks, what can happen is that the stool can fall over. And if the balance isn't right between these activities, then the stool topples. So symptoms can get in the way of balance in this way, and it can mean that there's a focus maybe on routine or necessary things just because of how much energy someone might have, and less on pleasurable things, or less on things that might dampen down that stress response, like the exercise that we just did. And actually, if the balance isn't right, then the stool won't stand well and it will just keep falling over. So it can be really difficult to do this and learn to think about balance in this way when managing symptoms with long COVID, but it's something that's quite important to be able to do, and pacing is one way of learning to do that. So we would encourage you to join those other webinars to think about how to pace activities and think about getting a better balance with routine, pleasurable and necessary activities, and thinking about how you might manage your energy levels. And discussions about an energy envelope will be something that gets talked about in other webinars.
And just a quick mention, as essential to all of these webinars, and in terms of maintaining that balance that Chinny was mentioning, it's really important to make sure that we keep on top of our general well-being. So things like good diet, sleep and reduced alcohol intake can really help your body and particularly your muscles maintain your immune system and increase your energy levels as well. So just some references there. And
finally, we often find that the people who have been through our services often find it quite helpful to think about peer support where possible. And there is a COVID aid charity online that does weekly drop-in cafes on Zoom every week, and it's just a space to be with other people who also have long COVID, and feeling less alone with the symptoms can be quite a helpful way of managing. But there are also courses that are run online as well around how to manage breathing and thinking about fatigue, as well as self-management courses online that can be quite helpful as well if that's something that is appealing. But peer support is quite an important element of this as well, and not feeling alone with symptoms. And as I said, there's this further information about how you might access further help if you wanted to through services like ours. We've run through most of the techniques that we would encourage people to do and that we would go into in more depth if you were to join a psychology service. And there is a summary of some of what we've talked about in your slides after the session today. So we do want to go to the Q&A, but we did want to just highlight some common frequently asked questions that do come up for us within our services. So one of the first ones, I suppose, is that we often hear about people saying, well, what if professionals think the problems are all in my head, what should I say or do? And even this talk, like talking about psychological health, can be quite a challenging thing, because actually this is a physical condition. So often what we say to people is that yes, it can be really upsetting to not be believed about these experiences that are debilitating and are very much a physical health problem, and actually just being able to notice the impact that it can have on multiple systems, psychologically, socially, is very important. So it can be helpful to think about seeking help from a supporter, giving descriptions of what's going on and noting these things down, and having somebody who supports you to explain about the impact as well. So there's another person in the space with you if you find that someone's not believing you, but also asking questions about the clinicians' conclusions and how they arrived at a conclusion and how they've ruled out other problems, and maybe requesting to have this in writing to review at a later point as well with somebody, and respectfully asking to be referred to long COVID service or physical health services, because this is a physical health condition, is really important. So I think that we just want to advocate that we are recognising this physical impact, and when people come to our services in psychology, we often ask about if the physical health symptoms have been thought about and managed, and we try and advocate for people to access services to manage physical symptoms as well as thinking about the psychological impact. So we think it's both and that it's not about really prioritising one over the other. So we just really wanted to highlight that as well.
Another question we get is, what if I'm not interested in psychology? That's totally fine, both at UCH and in the community. We're a totally opt-in service. Some people prefer to have a go at using self-help materials or their own strategies and techniques to cope, which is absolutely fine, and we do encourage that as well. If you're in a position to do so, then continue what you're doing, create your own spaces to review your situations and reactions and reflect, and make any plans based on your learning about yourself and any reflective cycles. And this can help you to manage your symptoms yourself in the long term. And of course, if you do change your mind and would like to access NHS psychological therapies in the future, you can ask to be referred or can self-refer online at a later point.
Yeah, and then the one of the other questions is obviously, how do I refer myself for further help? All of the information about how to do that is in these slides. You just need to follow links to our services, and you can call our services. You can email to refer, you can refer online through a self-referral form, and if you are interested. And the waits for our services, we have standard waits, so that often people don't wait very long to be assessed in our services. So you might wait for, it could be less than a week, or it could be up to 6 weeks for an initial assessment. And then the wait for treatments might vary depending on what you're being offered. But we aim for people to not wait for longer than not longer than the maximum waits that is our target, is sort of a 3 months wait for therapy, but it might be sooner than that depending on different times, depending on the referrals at different points, so, and depending on what you're looking for. So just really wanted to highlight that. And then there's this last point, which is just that people are moving on and don't appreciate or understand my challenges because I don't look ill to them. And so we talk a lot about the invisibleness of long COVID for people who might not necessarily see what's going on inside you and just see the outside and think that things are okay. And so we try to think about the reason why we've sort of advocated for peer support, and we offer groups within our services often as well, is because an important action that you can take is to connect with other people with the same experience, so that it feels less isolating, and having those shared experiences actually can be quite, we hear from patients who've been through our services that is so powerful to reduce isolation, to reduce a sense of loneliness. And often in our groups, people talk about different ways and techniques for how to talk about their symptoms with people who don't really understand it, with work or with friends or with loved ones. And it can be quite powerful hearing that from other people who also have the symptoms, rather than just hearing about it from professionals in services giving advice. So those are all of the things that we wanted to run through, and then I guess we can go to Q&A and see if there are any other questions that you have for us as well. And just thank you for listening, really.